The CDC's Vaccine Advisory Committee convened today to debate one of the most significant changes to the U.S. immunization schedule in years. A proposal to expand routine hepatitis B vaccination beyond children and infants and into broader adult age groups. For decades, hepatitis B vaccination has been standard for newborns, but rising infection rates and thousands of preventable cases each year have pushed experts to reconsider how widely and how early adults should be protected. During the meeting, CDC advisors reviewed new data showing that hepatitis B infections have increased, particularly among adults in their 20s, 30s, and 40s groups who were either never vaccinated or missed early childhood doses before universal recommendations existed. Public health officials emphasize that hepatitis B is still a serious and sometimes deadly virus, capable of causing chronic liver disease, cirrhosis, and liver cancer, even though it is entirely preventable through vaccination. Coverage in adults remains far below national targets, leaving a large population vulnerable to infection. The committee discussed whether to recommend routine vaccination for all adults up to age 60, regardless of risk category. This would mirror recent policy shifts for other vaccines aimed at expanding protection and simplifying guidance. Proponents argued that broad adult vaccination would close long-standing gaps, reduce transmission, and prevent costly long-term complications. They also note that universal recommendations are easier for clinicians to follow, eliminating confusion around eligibility. Opponents, however, questioned whether the evidence supports such a sweeping change. Some advisors raised concerns about vaccine supply, financial impact, and the lack of robust data measuring real-world outcomes of adult vaccination programs. Others argued that targeting high-risk groups, such as people with multiple sexual partners, individuals with substance use disorders, or those in certain healthcare settings might remain the most efficient approach. The debate reflected familiar tensions in public health policy: how to balance precision with simplicity, and how to ensure protection without unnecessary cost. The committee did agree on one major update: strengthening hepatitis B vaccination within the childhood immunization schedule, reinforcing the importance of completing all doses on time. But the adult recommendation remains under review, with a final vote expected soon. If approved, the policy could dramatically expand access to hepatitis B protection and reshape preventive care across the United States.